Clinical psychologists work in different areas. With regards to why they might work with someone with MS, it can be primarily for difficulties relating to mood, but also there is the added factor that unfortunately some people with MS will have problems with things like memory and concentration. And that can be due to the direct effect of the MS itself, or it can be a kind of byproduct of things like fatigue, serious fatigue. The two main aspects of the kind of things I see, so it will be people who have difficulties with their mood, and it will be people who have difficulties with the more cognitive side, so things like the memory. I think everyone with MS at some point will experience a whole host of emotions, and that's completely normal. And to some extent, you know, we would expect people to feel worried, upset, sense of loss, sense of anxiety about what might happen. But I suppose it's prolonged feelings where things start to interrupt day to day. You know, so for example, if you're feeling very sad about things or start to feel depressed, and therefore start to kind of withdraw from friends and family or don't want to go out and things like that, that's when things start to get a bit trickier, and really where people should be you know, seeking help of some sort. And that can be where seeing a counsellor or clinical psychologist can be really helpful. There's a whole host of psychological therapies that people can use to help to work with a therapist, whether that be a counsellor or a CBT therapist or a clinical psychologist, to help through what it is they're experiencing, what the difficulties are. And the type of psychological therapy will depend on the kind of problems that the person brings. So how someone would perhaps deal with an issue around anxiety would be very different to perhaps how someone would deal with an issue around feeling depressed. It's only more recently that people are taking more notice of the fact that actually it does seem to also impact on cognitive processes with regards to things like memory, thinking, planning, the speed at which the brain is generally operating at, those sorts of difficulties, which are hard for people with MS because they're often the unseen difficulties. So we would look at all sorts of areas of the brain, their overall intellectual functioning, attention, memory, visual processing, all sorts of things, and that gives us an idea of how people's brains are going about doing tasks. And the actual tests themselves are more kind of like pen and paper type tests. There's no kind of necessarily right or wrongs. It's not. Why it's useful basically is that it gives us an idea of parts of the brain that perhaps aren't operating as well as we would expect, and it gives us an idea of how we could therefore help that person. And often that is by using what we call compensatory strategies. And if you can see that someone actually has a bit of difficulty with verbal information, remembering verbal things, well, you can say to someone, actually what we need to do is look at more visual strategies to help you remember things. So that, I think it's helpful to have people who understand about MS working in MS, because it's such a varied disease, because people are experiencing things that perhaps they don't experience in other disease processes. It's useful to have or speak to people who kind of have that knowledge, really. The other aspect is, particularly on the emotional side of things, I mean, people say to me, well, you could just have people accessing more generic mental health services. The difficulty I'd say there is that if you had someone who perhaps had memory problems or some sort of cognitive problems because of their MS, their ability to access more generic services would be harder. So if you've got someone who perhaps knows about MS, knows about cognitive difficulties, there's no reason why that person can't participate in psychological therapy such as cognitive behavioural therapy, which is one of the common psychological therapies that are used, but with variations